morning and welcome back to 5-Minute Monday Trends. Today is Monday, January 10th, 2022, and joining me as always is Dr. Timothy Bray, UTD EPPS Professor and Director for the Institute of Urban Policy Research here at UTD. Today we'll talk Omicron, but first, Dr. Bray, how are the COVID numbers in North Texas?
Well, Dani, Happy New Year. It has been a very busy break for most of us working in the COVID area. Omicron, the wave, has hit North Texas unmistakably. So this week, let's see, this is data as of Saturday. There are 105,000 new cases, almost 106,000 new cases in North Texas last week. More than 4 times the number of cases the week before. So these numbers, without a doubt, are trending off the chart. The good news is the vast majority of folks who are affected by this virus are not suffering severe illness. Now, that doesn't mean it's anything to laugh at, but they're not. The vast majority are not requiring hospitalization. Now, our hospitalization numbers have gone up because our case volumes have quadrupled in the last week. Active cases right now, 133,000 active cases, more than triple what it was a week ago. And this is true in almost every county in North Texas, especially in the big 4, right? Dallas, Tarrant, Collin, and Denton. Each of those counties has at least quadrupled or nearly quadrupled their new cases in the last week. This is leaving us with a significant hit on our hospitalization resources. Of course, hospitalizations are at 92%. ICU occupancy is at 96%. And we, of course, are experiencing staffing shortages in a variety of industries, not just healthcare, but also schools that are dealing with a large number of teachers that are out. Retail that is dealing with a large number of staff that are out. 2 Walmarts now, I believe in North Texas, have closed because of the need to deep clean after an outbreak among their staff. So we are absolutely in the throes of this virus right now. And Dani, let's talk just a moment about the trends. These are the active cases all the way back to March of 2020 for the state of Texas. And you can see here we have our peak in January of 2021, the spike that we saw in the fall from Delta, where active cases peaked in the state around 286. We're already now with Omicron up at double that, 534,000. So almost double the number of cases that we had. And this spike trend, right, the same is true down here on the right-hand side. You see for new cases back in September, we were peaking around 20,000 new cases a day in the state. We're now triple that at 60,000 new cases per day. And let's just take Dallas County. The exact same pattern holds, right? We're at about 6,000 cases. We were peaking around 2,000 new cases a day. Our active cases in Dallas County are up almost 50,000 active cases in the county. So again, this is not like any previous waves that we have seen. It is definitely affecting everybody everywhere.
Absolutely, Dr. Bray. Thank you so much. And I think we could spend so much time talking about Omicron, but specifically from your perspective with the data, how long do you think this is going to last? How long do you think until the numbers start going down?
Sure. Let me tell you what UT Southwestern is projecting, and they've been a really good source of modeling for North Texas in particular. You know, if we keep our current level of safeguards, so masking to the extent that we can, of course, washing our hands and social distancing. They're forecasting somewhere a peak of new infections somewhere in the end of January and a peak in hospitalizations in around the 2nd week of February. So, you know, the really good news is this is a virus that moves fast through the population. Unlike some of the earlier waves where we were sitting in this for months, we should be through this within a matter of a few weeks. So, you know, we need to hold tight. We need to stay vigilant. We need to not overload our healthcare resources if at all possible. So, you know, tests are scarce. Getting tests just so you can get tested is not necessarily a very good use of the testing resources that we have. Again, don't go to the ER unless you're actually sick and need emergency services. See your local healthcare provider or any one of the dozens of testing sites that are now available.
Absolutely. Thank you, Dr. Bray. And I have one more question for you.
Sure.
Last time when our last 5 Minute Monday, Omicron was estimated to be about 5 to 20% of the cases, and now that is definitely not the case. Can you give us an updated number with
Sure.
that?
Yeah, Omicron is the vast majority. The last number I saw was the estimate was around 70 or 80. With the margin of error, it could be as much as 95. We are still seeing Delta cases, but not nearly like we were a month ago. At sort of the beginning of December. Omicron is for certain the vast majority of the contagion that we're seeing, but be on the lookout. Delta is still around.
Awesome. Well, thank you so much, Dr. Bray. We will be back next week with another update.
Fantastic. Thank you, Dani.